Hello, my name is Lauren Madrano, and I will be doing the SBAR report for my second shift, taking place on June 27, 2023. OM is an 18-year-old male that weighs 74.8 kilograms. He is 164 pounds and 14.5 ounces, and came from the PICU and has no known drug or food allergies. His Erickson stage of development is intimacy versus isolation. He has no developmental delays in his medical history, although his current state is deficit neurologically. The patient's primary problem during the clinical shift is agitation, increased blood pressure, and increased secretions. The patient was admitted on June 22, 2023. The patient admitted diagnosis is a sinus infection with a subdural empyema. On May 31st, the patient had a running nose and a fever at home and went to urgent care and was treated with Tylenol and amoxicillin. On June 16th, the patient had a headache and fever. On June 18th, the patient was unresponsive and was taken to OSG AMS, where they noticed seizure activity. The patient was intubated and was showing unequal fixed pupils. A CT scan was ordered and showed subdural epidural fluid on the right side of the head with severe sinusitis. A blood culture was also ordered, which came back positive for streptococcus. On June 19th, a hemocraniectomy was done on the patient, taking out the right bone flap. The list of medications that the patient is currently on is levetiracetam, which is Keppra, oral 1,000 milligrams, albuterol, INH nebulizer 2.5 milligrams, vancomycin injection 1,250 milligrams, with sodium chloride 0.9%, morphine oral solution 21 milligrams, lorazepam oral tablet 2 milligrams, acetaminophen oral suspension 500 milligrams, and clonidine injection 50 micrograms. The patient is up to date with his immunizations, and the mother is currently at the bedside. The patient is currently on an NG tube that is located at the right nares and is a size 17 French, and is on a feeding of 75 milliliters per hour continuous. The patient has no right bone flap and an EVD that is 10 centimeters open to drain every hour. The patient is strictly on post-ox and EKG continuous. He has a PICC line that is heparin locked and located on the right arm, and a peripheral IV line on the patient's left hand. The patient's MAP should be at 80 to 100 with a systolic of less than 150. The patient's current vitals are blood pressure 158/109, MAP of 128, pulse 61, respirations 20, temperature 97.5 Fahrenheit, oxygen saturation is 99%. The patient does have an MRI pending due to the continuous feeds. The respiration is clear and coarse. Pupils are sluggish and are at a size of A2. We had to have 3 other nurses to triple check his pupils due to the initial sluggish response. His secretions is thick and cloudy. Suction is done every 2 hours. Pulse is equal times 4 palpable. Capillary refill is less than 3 seconds. And the patient is awake and agitated and slightly responds to stimuli. The patient is neurological deficit due to the hemocraniectomy. The patient will understand and follow commands, although there are times when he does not. Scheduled labs to be done are C-reactive protein, KM10 panel, and a sedative rate. Supporting the priority problem is to suction secretions, keeping the patient's agitation under control, blood pressure monitoring and management, and preventing harm by having a sitter. The nursing care management of the problem was strictly recording vitals every 3 hours, neurological checks every 2 hours, and a drainage of the EVD every 1 hour. The therapeutic management of the problem was to suction the patient every 2 hours and give albuterol treatment to help with breathing and loosen the thick secretions. The patient was agitated throughout the shift. The scheduled morphine medication was provided for the agitation. The patient's blood pressure was high, which was 158 over 109, MAP of 120. We then called the doctor about his increased blood pressure being a concern. He stated to use a third-line drug named clonidine, which is an agitation medication, but can also be used to help decrease blood pressure. After administering clonidine, the patient's blood pressure slightly lowered, but was still in the high range, which was 150 over 100 and MAP of 120. Education was provided to the patient and family about EVD drainage, to call the nurse if the patient is being removed, and the importance of a sitter due to the patient become very agitated and might pull out his EVD, NG tube, or PICC line. The patient's mother was also educated about the medication clonidine, which can help for agitation and help decrease blood pressure. Thank you.